Hello, good evening, everybody, wherever you're joining from. Nice to see you. I am going live now with Dr. Venkat, who is brilliant, and she is the Medical Director of Harley Street Fertility Clinic. She's here now, and we're going to be talking all about miscarriage and recurrent pregnancy loss and how that may or may not affect fertility, IVF, getting pregnant again, what you need to consider, why it may happen, support available, all of the above. So hi to everyone who's joining. Nice to see you. Dr. Venkat now. Please have your questions ready. She's always happy to answer them. Here she is. Hello, Dr. Venkat. How are you?
I'm very Eloise. Nice to see you. How are you doing?
I'm well, thank you. It's so lovely to see you. It's been a while. How are you?
Yeah, I'm good. Now COVID is sort of settling down recently.
Yes.
And so we are back to normal and we are getting more patients. We are making more people happy.
Brilliant. I'm glad.
Yes.
Now, today's topic is obviously a very difficult one for anyone who is or has struggled with pregnancy loss. And we're going to be chatting a little bit. Oh, first of all, please could you tell us who you are? I've mentioned that you are the Medical Director of Harley Street Fertility Clinic. I've mentioned the topic that we'll be discussing, miscarriage, and how that may or may not affect treatment, getting pregnant naturally, what you may want to consider, support available. But if you could please just give a brief introduction to yourself and who you help and Harley Street Fertility Clinic, that would be wonderful. And then we'll start talking about all these very important topics tonight.
Thank you very much, Eloise. I will do that. My name is Dr. Venkat. I'm basically a gynecologist and an IVF specialist or fertility specialist. I have been doing this for the last something like 25 to 30 years now. I've been in Harley Street. My first IVF baby now is something like 24 years old.
Wow, amazing.
Yes, time just flies. And I have seen all the changes going through the field. And, when we started, the success rate was very low, only 20 to 25%.
Mm-hmm.
It's starting at 70%, which is brilliant. So the technology has improved over the years, which is good news. And I set up my own clinic in 2010. I founded this clinic. It's called Harley Street Fertility Clinic. The ethos of the clinic is to look after the patient, give them the best care during their journey. We don't call it a treatment, it is a care. And that's why a lot of people, even if they don't get pregnant, they say, look, we are very grateful for you and your team. All of you did your best, and unfortunately it didn't work, but we'll come back again and we will do it again. Of course, who go home with babies, they are full of praises. I don't need to mention that. And that is why we say, look, we are here to help you, make use of us, and we will do our best for you.
Mm-hmm. Fantastic. And so talking about baby loss, whether that's recurrent or you've experienced it once, if anyone has any questions as we're talking for Dr. Venkat, please feel free to ask. She's more than happy to answer, and I'm going to link up in the bio the link to Harley Street Fertility Clinic so you can have a chat and schedule an appointment to have a personal consultation, which I suggest that you do. So what are the main triggers and reasons why a woman would miscarry or may miscarry?
Yes, so there are so many factors involved in this. First of all, like you said, Eloise, I would like to say miscarriage is a very traumatic event in anybody's life. There is a lot of grief associated with that, and others probably don't realize the importance or seriousness and the grief associated with miscarriages. People don't talk about it too much. Okay, you miscarried, you can try again, you will have a baby. What is the big deal? That is not the attitude. It is like they have lost their baby. That is so important. Mm-hmm. And if you look at it, the miscarriages are more common women over the age of 38. That is, here it is related to the age and the quality of the eggs. As the egg age increases, the quality of the egg deteriorates, and it leads to chromosomal abnormalities in the embryos, which leads to miscarriages. Mm-hmm. Why we say have your babies earlier, because your eggs are better, they have better quality, and you'll also have more eggs. And so that is one of the important causes of miscarriage. Young woman under the age of 35, there is a risk of 15% risk of miscarriage.
Okay.
So any person, there is a 15% risk of miscarriage under 35 years. But this risk increases as one gets older. Say, for example, at the age of 40, the risk increases to 30. And then over the 42, the increases to 50. And as age increases, it increases dramatically and significantly. This is all due to the quality of the eggs. And that is why we say, look, it's important for you to do something, preserve your fertility if you need to. And that is the common cause of miscarriage. But there are also other causes. It's not only to do with the egg quality, because sometimes we see young women having recurrent miscarriages. On Saturday, I had a list of patients for consultations, and I had 2 patients. One of them was 34 years old. She's a young patient according to our classification, under 35, good prognosis patient, but she had 7 miscarriages. So that is very unusual. I don't think it is due to the quality of the eggs.
Okay.
Something else in her body which is causing this problem. So that's why all the miscarriages are not due to the same causes. They have different reasons as to why they happen.
So for a patient that you just mentioned in that situation, what kind of factors could be at play there? What would you investigate there?
First of all, having said that, it's unlikely to be the egg quality. I will always check her fertility, ovarian reserve, and the egg quality by doing an ultrasound scan and also a blood test to check all her hormones relating to fertility, like anti-Mullerian hormone. That will tell us how many eggs she has got. Supposing if it is very low, less than 5, then the last few eggs in her ovaries, the quality will definitely be affected, even though she's only 34 years.
Okay.
And hormone called FSH, follicle stimulating hormone, it gives us information about ovarian function as well as indirectly the quality of the eggs. So we check all this to get a basic idea of a woman's eggs.
Mm-hmm.
Supposing they are all normal, then we go to the other investigation.
We've had a couple of private questions come in. Are you happy for me to ask you some questions as we go, just so that people can get your thoughts? So one of the ones is, can your nature of job cause miscarriage? So can it be something to do with the way that you're living, or if you're super stressed, or you have a very physical job? I mean, I don't know what kind of job this lady has, but do lifestyle factors come into play?
They do play a role in these miscarriages, because as we know, stress affects so many hormones, including the hormone called prolactin. It's called stress. Yeah. It goes very high. And then the relationship between FSH and prolactin and TRH, that is thyroid releasing hormone, all these are affected. And if these are affected, if there is not hormonal balance in her system, that will affect the quality of the eggs. And generally, other lifestyle factors like smoking increases the risk of miscarriage, because smoking reduces the number of eggs and definitely affects the quality of the eggs. So smokers have a higher risk of miscarriage. And if somebody takes recreational drugs, again, the quality of the eggs will be affected. So lifestyle factors are important. And it's also what we eat, what sort of diet we eat. We eat if we eat a lot of processed foods, they contain chemicals and they are not good for our health. And we also drink water from plastic cups, and that is not good, because any plastic mixed with fluid, and if it stays there for a long time, it forms parabolic acid, which is a chemical which is not good for sperm, not good for eggs either. And when such couples have, try to get pregnant and they make embryos, they can end up having miscarriages. So lifestyle factors, modern life, stress, and all these, takeaways, all these things are not helpful. Go back to the old way of living. Eat, cooked food at home, and also lots of fruits and vegetables, water, this kind of things. Natural food, plant-based food is much more helpful under these circumstances. And like you said, what sort of job she does. Supposing somebody does lot lifting things, heavy, that can also affect early pregnancy.
Okay. Yeah, because after you've had treatment, you're advised not to lift or do too much physical strenuous activity, aren't you?
Absolutely right.
Someone has asked, I'm so sorry, they've just said that they're experiencing their 4th miscarriage currently, and they want to know whether you can ovulate whilst you're miscarrying or soon after.
No, while you're miscarrying, that means you are losing the pregnancy. Your pregnancy test will still be positive, and at that time you will not be ovulating.
So how soon might you get your cycle back?
Yeah, so that's a good question, Eloise, because we think that, okay, I should have my period in 4 weeks' time. If that is the usual cycle length for the patient, they'll think that, okay, I had the miscarriage, I'll have. No, normally the body has to recover from the miscarriage and the ovaries have to start their function again. There is usually a delay of 1 to 2 weeks of miscarriage, and then the ovaries start working, ovulation occurs, and then the period comes.
Mm-hmm. Okay, thank you for that. What about blood tests? Which blood tests can you have for miscarriage, and what do they show?
Okay, so when you say what blood test, is it diagnosing miscarriage, or is it the finding out the cause for miscarriage? There is a lot of things involved in miscarriage.
I guess both, really. What options are there to investigate further to try and prevent it in the future?
Right. Okay. First of all, it's actually a good question. It involves a lot of, subheadings. First thing is, okay, say somebody is pregnant and they have done the blood test to confirm it, and they start having light spotting, and we always worry. Then is the pregnancy still normal, or is it sort of not going ahead, and am I miscarrying? That is the question in everybody's mind. And how do we diagnose that the pregnancy is still all right? So we ask them to repeat the blood test for what is called beta HCG. That is the pregnancy hormone we measure in a woman, which will tell us, okay, this is a good pregnancy level. And that alone is not good enough. What we have to do is we have to repeat it after 48 hours. And during this time, it should increase by 66%. We say it nearly doubles after 48 hours. So if it doubles, then it shows that the pregnancy is progressing well in spite of the bleeding.
Mm-hmm. Okay.
Whereas supposing the level is something like 100 on the first day when we do it, and second time when we do it, it's 140, it's not gone up according to the range. So that means it's not likely to be a good pregnancy.
And is there anything you can do to help at that stage?
That stage is a bit late to do anything, because already it's not a viable pregnancy. Whatever you do, you're going to support the pregnancy, but it's not going to be a viable pregnancy. The baby will not be alive at that stage. So we can't do it. But if at all we need to know what to do in future, how to prevent such a thing happening, we usually say some of the pregnancies are lost due to deficiency of the progesterone in the second half of the cycle and in early pregnancies. This is very typical in women with polycystic ovaries, because they have hormone imbalance and they have high estrogen in their body because of the polycystic ovaries, and the eggs take a long time to grow, so the estrogen is going up and they don't ovulate. That's why they have periods once in 3 months or 4 months. Under these circumstances, when they ovulate, after that also the progesterone is not high enough compared to the estrogen. Therefore, some of the pregnancies are lost. Therefore, we say in women with polycystic ovaries, it's important to check the progesterone. Not only with the polycystic ovaries, someone has had miscarriage in the past, it's a good idea to check the progesterone in the next pregnancy and maybe supplement, give some extra progesterone to support the pregnancy. All these people will need is extra progesterone in the form of cyclogest pessaries or utrogesterone pessaries. And the levels will go up and it will support the pregnancy. So that is one of the simplest causes of pregnancy loss, early pregnancy loss. So that we can find out by doing the blood test to check the progesterone level at regular intervals. That's what.
Okay. A question that's come up, which we hear a lot in the community, and I asked as well, was intralipids. What are your thoughts on intralipids? So steroids, immunology, sorry, intralipids, steroids, etc. Blood thinners if you have a blood clotting disorder.
Yes. So that is the next blood test we will do. Say, for example, in the lady who I mentioned, 7 miscarriages, and she has had 5 IVFs and followed by 5 miscarriages, 2 spontaneous pregnancies, both of them were miscarriages. So in her case, she asked me, and she was 34 years old. I said, look, we can check all these fertility tests first, but in such recurrent miscarriages, it's important to do these immune tests. These immune tests consist of 4 parts, basically. And the first one is called thrombophilia screening, or in layperson's terms, any blood clotting issue. What we are trying to find out, if someone has got a sticky blood, that means then they have a tendency to form clots, particularly in the placenta, that will reduce the blood supply to the fetus, embryo, and the baby. So it is the continuous process. So if it is not affected in the early stages when the implantation doesn't happen, or if the implantation happens, missed miscarriages due to reduced blood supply, or later on, they sometimes have intrauterine death or stillbirth, and the placenta is affected. And that's why, sometimes it can cause problem with the baby's growth also, fetal intrauterine growth restriction. So due to the blood clotting issue, that is the first issue in the immune test. So we test that. Second part is called autoantibodies. So the name itself is self-explanatory. Antibodies are in our system to protect us from bacterial infections or viral infections to help with their immunity. What happens, autoantibody means these antibodies which are supposed to protect us, they act against our own tissues and cells. And they also go and affect the embryo.
So what happens if you have a heightened immune system like that, or these antibodies?
Correct. So we check so many antibodies. We have seen so many patients with commonest ones are thyroid anti-nuclear antibodies and microsomal antibodies, mitochondrial antibodies. There are so many of them. And if you have antibodies, there are 2 treatments for that. One is we give them steroid, prednisolone tablets or tablet to suppress these levels of the antibodies. Okay. And they will also respond to intralipid infusion. These 2 are the first basic test. Then comes the 3rd and 4th part of the immune test, Eloise, and that they are called natural killer cells and cytokine. Play an important role. People with a lot of autoimmune issues, particularly if they have autoimmune issues in their family, they are prone to have this kind of issues. And at this stage, they may not have a high level of the natural killer cells, but later on they can develop it. So if the natural killer cells are high, again, they go and they cause inflammation in the uterus and attack the embryos. Similarly, the 4th part is called the Th1, Th2 cytokine ratio. These are products associated with natural killer cells. And if their levels are high, they also create problem, prevent implantation or miscarriages. Recurrent miscarriages are notorious. You might have heard that people with lupus, which is sometimes common in some families, these women have recurrent miscarriages. That is all due to all this high lupus anticoagulant and anticardiolipin antibodies and sticky blood and all these issues. And the treatment for this, of course, will depend on how high the natural killer cells are, how high the Th1, Th2 cytokines are. If they are moderately increased, then they will sort of settle down with intralipid infusion. But if they are more increased, sort of more than certain level, then they need a stronger drip called intravenous immunoglobulin. But generally, the intralipids, these intralipids are fat solutions, and the products are derived from egg and soya. As someone is not allergic to these products, they will not have any side effects or reaction. These are innocuous products, and it's given in the form of a drip, and it suppresses all these immune issues, and it heals very beautifully. We see the levels going down very nicely. That
I had that, yeah. Someone has just asked, could you just repeat the name of the test to check if you have natural killer cells? And I presume that you offer that testing at Harley Street Fertility Clinic?
Yes, we call it immune testing.
Yep.
These are called thrombophilia screening, antibody screening, and natural killer cells and cytokines. And we offer, and I tell you, we have had patients with 8 miscarriages. She was 42, 8 miscarriage following 8 IVF treatment. And we did this test and we treated her. You may not believe this. She went home with a little girl in the first attempt of IVF with us.
Oh, amazing. Amazing.
The steroids.
And someone privately has just asked, they're 34, they've had 2 miscarriages. When would you know to seek specialist help? When would you advise a patient to come and see you in that scenario?
Okay. Generally, the NHS and the NICE guidelines advise that women should be investigated for miscarriages after they have had 3 miscarriages. But when we see women, it is hard for me to tell a woman, look, she will come and say, I have had 2 miscarriages, doctor. What do you think I should do to prevent it in future? I can't tell her, look, we won't do any investigation. Go and have another miscarriage. Come back to me, then investigate. So if someone has had 2 miscarriages, it's better to at least consult a fertility specialist or miscarriage specialist and see, do the basic investigation. Even if you don't want to go for this immune testing, see where the problem is, why you have had 2 miscarriages.
Yeah.
There is a family history of autoimmune issues, then it's important to do these tests.
That was my next question. Can miscarriage be hereditary?
Yes, it can. I mean, I won't call it hereditary. I will say it can occur in the families, familial.
Okay. And why is that?
Why? Probably they carry similar genes.
Okay.
Genetic factor causing all these immune factors. Because again, I had a lady who is young, and she said that her mom had 5 miscarriages. Then she had 2 children, 2 girls, she and her sister. And then she said her sister also had 4 miscarriages.
Wow.
Okay, and she's still trying for a baby, she said. And this woman, she had 1 miscarriage. And she said that because of my family history, I am worried, I have come to you. And I think under these circumstances, I wouldn't wait for her to have 3 miscarriages. No. I will start the investigation straight away. I can help her to prevent miscarriages in future.
Absolutely. Sarah has written that she's had 8 miscarriages. I'm so sorry. She's been to see you at Harley Street Fertility Clinic, and you're helping them work out the reasons why, and you're working together to get their happy ever after. And that's such a lovely thing to hear, that you're working together, to get obviously what everyone is wanting to achieve, working together as a team to do that. Like you said, all about care versus treatment. And I love the way that you're looking at it like that. It very much is, because it's so emotionally led, isn't it? And
Sarah. I appreciate your words. I know your details. I remember. And so we are still with you, holding your hand and supporting all you do. Okay? You all.
And on that note, because I know we've talked a lot about the sort of medical side of things, in terms of holistic support, I know that you have a fabulous counsellor, don't you, at Harley Street Fertility Clinic, Molly. Can you tell us a little bit about how people can be supported when they're going through these difficulties?
Yes. So Molly has been doing fertility for a long time. She's an experienced counselor, as you know, Eloise. And whenever we have patient who's having miscarriage, because these things happen suddenly, they have a positive pregnancy test and everything is okay with the beta HCG level, and they come for 7-week scan and there is no baby or no fetal heart, in which case it is a miscarriage. It comes as a huge shock for the couple, and they are sitting there, and then I request one of the nurses to call Molly and have a chat with them same day on the phone at least, if not Zoom, so that she can give them the support. Now we have a new system in Harley Street. It's called a Harper's Well-Being Support Scheme.
Tell us about that.
Yeah. So this is a new company. They have counselors and people, professionals trained in counseling. And what they do is they follow the patients through their journey, which is nice because there is no extra charge. You can register with them and they will then give you a call. Say, if you are starting the treatment next week, they will give you a call and say that, look, shall I call you next week on this day at this time to see how you are doing? And then they are on the day that patient may be feeling all right. So she will say da 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 everything. And then after the second scan, supposing things are not going well, then they will feel down. So then this patient, the same person will call and say, look, okay, don't get upset. And they will give tips to cope with the situation.
Amazing.
Buddy, they are like a friend talking. They are mental. And this is all confidential. We have that. And if anybody has miscarriage or anything, they will continue to offer the support. And Molly. And we also offer acupuncture. Sometimes what happens with miscarriage, we have diagnosed miscarriage on scan.
Yeah.
We tell the patient, stop all the medications, you will bleed. And sometimes there is a delay in starting the bleeding. And that is very painful for the woman, especially. She doesn't want to carry this baby anymore, and it's psychologically upsetting her thinking about it. So we send them for acupuncture, and acupuncturists, they talk to them, and also doing some acupuncture will start off the bleeding is earlier, so that they can sort of, complete the miscarriage process and get over it quickly. So, and nurses always talk to them. And we have a very experienced nurse, Marianne, and she has been doing this for 20, 30 years. And she has been with me since the beginning of the clinic. She's so lovely. We call her Agani aunt of the clinic. And whenever somebody has miscarriage in my room, she comes and takes them to our private room, makes them a cup of tea, our way of consoling everybody. It's not going to solve the problem, but at least sit with them, talk to them about it. It sort of takes time to heal this process.
Of course. And that's why I like your holistic approach, from all these various ways of supporting people as well as the medical side. It's so important. I don't know how people listening feel about that, but from my own personal experience of holistic support, I know how invaluable it was for me. And I wanted to ask a little bit about, we've had tons of private questions, so thank you to everyone that sent them in. What I suggest, because we don't have time for Dr. Venkat to give personal consults during our live, but I'm going to link up the details to Harley Street Fertility Clinic. Please contact the team. They're wonderfully helpful, and she'd be very happy to have a consultation with you to talk about all of these things and anything else that you want to cover. We've introduced a lot of our readers to to the team, and we're always happy to do so. So either feel free to contact us directly, or we're happy to put you in touch. And miscarriages and fertility. If someone who has had a miscarriage and they're having IVF, or so they've had a miscarriage naturally, or they've had a miscarriage following treatment, and they're going into treatment, or they're trying again naturally, does that affect their chances of getting pregnant again?
No, it doesn't. Actually, I will tell them, look, you have gone one step further. The implantation has taken place. We know that, but the pregnancy didn't continue. So it doesn't reduce their chances of getting pregnant again or getting pregnant with IVF treatment. But like we said earlier, we must do the correct investigations to support the pregnancy, that you don't miscarry. And one more thing, if people are going for IVF, Eloise, I will say consider testing the embryos, pre-implantation genetic testing for aneuploidy. Because if someone has got a miscarriage, most of the miscarriages are due to chromosomal abnormality of the fetus. And that is why we say, look, if you are going for an IVF, you can prevent miscarriage because you have all the embryos and you test the embryos on day 5 and freeze them so that we get the results. It takes 2 weeks to get the results of pre-implantation genetic testing. And in our clinic now, we are routinely offering it to all the couples.
Okay, that's good. Okay.
That way, you won't believe, last 2 years since we started offering this, our miscarriage rate is extremely low.
Fantastic. And is miscarriage more likely in the early weeks of pregnancy than later in pregnancy?
Correct. These are all early miscarriages. That is called first trimester miscarriages, because there is some developmental abnormality, or there is not enough support with the progesterone, or immune issues. Most of them usually happen in the early stages of pregnancy. That's
Well, thank you so much, Dr. Venkat. We've covered so much, and I know that there's so much more that we could continue to talk about. So for anyone who has further questions, wants to have a consult, please do speak to the team, and Dr. Venkat and the team holistically are happy to help. So thank you so much for your time this evening. Really, really appreciate it. And thank you to those who joined.
Thank you, Eloise, for the opportunity to talk to and help. Okay.
Lovely. Thank you. Have a good evening. Bye-bye. Bye.